Hello, I'm Dr. Hadley Sharp, a radiation oncologist. When you're told you have cancer, radiation treatments are often a part of your care plan. And when you're told you need radiation, many questions come to mind. My colleagues and I have put together a brief video for you, which is an overview of what you can expect and gives you questions you can discuss further with your care team. Whether radiation is delivered before, after, or at the same time as chemotherapy depends on the exact details of the type of cancer that you've been diagnosed with. In some cases, radiation is delivered instead of surgery, prior to surgery, or following surgery. Your radiation doctor is known as a radiation oncologist. They are a cancer doctor who delivers radiation and have many years of specialized training. Radiation oncologist works closely with your other doctors to determine the exact timing and combination as well as the sequence of therapies. Each type of cancer requires a certain number of treatments delivered over the course of many days or weeks. Your radiation doctor will discuss with you exactly how many radiation treatments are needed for your exact situation. When your radiation oncologist determines that radiation is needed, the first step in the process is to plan your radiation. The planning CT used to plan your radiation is referred to as the CT simulation. This will be done with the use of a CT scan. Unlike many of your diagnostic scans, which involve the injection of contrast or drinking contrast, radiation planning CT scans rarely involve contrast. Over many years, the technologies involved in planning radiation have evolved significantly. This has led to a dramatic reduction in side effects and increased accuracy. At the time of your CT simulation, we will go to great lengths to ensure that we can line you up in the exact position each day for treatment. This can sometimes include tattoos, or more commonly, semi-permanent marks on your skin. In addition to external skin markings, your radiation doctor will look at your internal anatomy and all of your neighboring normal organs, which will be largely spared during radiation treatment. At times, additional measures will be taken to localize internal organs as well. This all depends on where in your body your cancer is located and which important organs are in close proximity to your cancer. This can include special devices to track your breathing, external compression, having you hold your breath, fill the bladder, or empty the rectum. At times we'll place markers over your surgical incisions, or sometimes have you avoid eating or drinking prior to your radiation treatment. At times, the radiation therapist and your doctor will create a custom cradle for you with a soft, airtight bag, which when molded and air removed, becomes a custom immobilization device for you. If your cancer is in the head or neck, sometimes a custom mask is made for you. All of these techniques help to get you and all of your important anatomy into the exact same position each day. Here at Levine Cancer Institute, we have a network of technologically advanced treatment centers, so you can often receive the highest quality treatment close to your home. Some treatment positions or compression devices are uncomfortable, but we will go to great lengths to make you as comfortable as possible. The exact treatment position will be slightly different for everyone. The details of your position will be largely determined by what type of cancer you have and by your individual anatomic needs. Many patients lay on their back for treatment, but for some tumors, it is better to be treated when laying face down. Your doctor and your radiation therapist will work very hard to get you as comfortable as possible. Once your anatomy has been captured in the exact position you will be treated each day, you will leave the radiation oncology department. With a team of specially trained physicists and dosimetrists, your radiation oncologist will work hard to create a custom, safe, and effective radiation plan for you. Although you may not meet the physicists and dosimetrists involved in your care, they are a vital part of computer-based planning and technologically advanced treatments. Painstaking effort and many advanced computer systems will be used to accurately target the area in your body needing radiation and to minimize radiation to all of your important organs. As you go through your daily treatments, sometimes over the course of many weeks, you will get to know your care team well. A team of caring professionals will be there to ensure your health and wellness and promote a culture of safety. Nurses will be involved in many ways at many of your visits, ensuring you understand how to take your medicines, helping to manage your radiation side effects, and aiding in the coordination of your care across multiple departments. As you proceed through treatment, you will talk with the radiation therapists every day as they set you up accurately for radiation. Many advanced imaging systems are used in the Levine Cancer Institute to accurately track your anatomy or tumor movement and to ensure precise treatment delivery. Your team of radiation therapists will work together with your doctors and nurses to ensure you are set up correctly each day and treated with precision. During your radiation, you will see your radiation oncologist frequently. At these weekly visits, your doctor will review side effects with you, give you instructions and medications to manage your side effects, and discuss how your treatment is going. Our goal is to empower you and engage you in your care. You are encouraged to ask questions, as the better you understand what is happening to your body, the better your doctors and nurses can care for you. While the treatment itself does not involve any needles or immediate pain, the effects of radiation may have different symptoms depending on which part of your body needs treatment. Unlike chemotherapy, which is often injected into your veins and can have side effects from head to toe, radiation benefits and side effects are largely limited to where your radiation is targeted. For example, with tumors in the pelvis, side effects can involve the bladder or bowel causing diarrhea. For cancers in the chest, side effects can be cough or involve the ribs or swallowing tube known as the esophagus. The area being targeted with radiation may lose hair or may have darkened skin that could peel. Often, radiation can make you tired. This tiredness increases slowly as you proceed with daily radiation and then often improves after you have completed your treatments. Your doctor will talk with you in detail about the specific long-term side effects you can expect from your individualized radiation treatments. In total, there will be many teammates involved in caring for you prior to, during, and after your radiation treatments. In addition to your many doctors, nurses, radiation therapists, physicists, and dosimetrists, this can also include dietitians, nurse navigators, social workers, counselors, schedulers, physical therapists, translators, chaplains, volunteers, and many others. Everyone throughout this section of radiation oncology, the Levine Cancer Institute, and the Carolinas healthcare system will work together to provide you the most advanced, safe, and effective cancer care available.